So, good morning, Prof. Jayaraj.
Yeah, morning. Yeah, sure.
Good to have you here. Maybe before we start, if you can just, introduce yourself so that, listening can know you better.
Yeah. So I'm Dr. Jayaraj Pandian. I'm the professor of neurology and also dean at Christian Medical College, Ludhiana, in Northwest India. I'm the current president of World Stroke Organization. I've been associated with WHO since 2008. Started as a board of director from Asia Oceania, and then vice president from 2018 to 2022, and 2022 to 2024 as president-elect, and I'll be completing my tenure as president in October 2026.
Thank you very much for your presentation, and very happy to have you here. So, my first question is: we know that World Stroke Organization has been advocating, for stroke for long, and for like a kind of the will to have a maybe greater political attention on stroke for many years. So, from your perspective, what changed to make a dedicated World Health Assembly resolution on stroke possible in 2026?
Yeah. So I've seen the organization grow from 2008, right from its inception with the new board. I was part of the founding board. I remember a couple of past presidents were involved in advocacy, but not in a large scale. For example, our initial efforts were in the ICD-11 classification of stroke as cerebrovascular diseases. That itself took many years. And then the second important advocacy was uh, mm, uh, including the TPA, the thrombolytic agent, in the essential drug list of WHO. So that was probably the second important advocacy work that we did. And uh, I think that was sometime in 2014. And then in parallel, we have worked with WHO. One is on uh, the stroke care pathway at primary care level for both heart attack and stroke. That was in sometime in 2017, maybe. And then from WHO CRO, since 2016, I've been involved with them in developing awareness material for stroke, and also uh, uh, improving stroke care at all levels of healthcare. And there's a document published by WHO CRO in 2021. And we had helped, and slowly it has built in the awareness, the importance of stroke. And the major breakthrough, I would say, is the creation of Global Stroke Action Coalition with the civil society and industry, and also with WHO. That has really helped us to, bring that all the previous efforts together and push the stroke in the agenda for the World Health Assembly.
Wow, fantastic. So, a kind of a long road of recognition, and the coalition was a kind of game changer, to have this resolution on. So, so after years of advocacy, the resolution has not been adopted, right? So, what in practical terms do you expect to be different because of this resolution from government, from health system experts, clinician, but people also affected by stroke?
Yeah. So the main difference, I would say, is the resolution that is going to make a significant impact is because it is accepted in World Health Assembly. We can boldly contact member countries now through WSO, and also through our center as a WHOCC. Any region we could go. This is a resolution that is adopted by World Health Assembly that will give us more authority, to approach these countries, particularly the Ministry of Health. That is the one main difference, I would say. And also, when we work with WHO and come up with a strategy, show both short-term, long-term strategy, and try to involve in other WHO regions and also the ministry, that will really have a great advantage because of the resolution that is adopted in World Health Assembly, and
Right.
it will strengthen the top-down approach. WHO has been always doing the bottom-up approach, identify the stroke champion in the country, or work with the regional or national stroke association and try to do the bottom-up approach. But here, the top-down approach will be strengthened, and to me, that would have a long-term impact and sustainability. Yeah.
Wow. Okay. So the resolution will be a kind of door opener to the
Yes.
countries, and also help, World Stroke Organization and partners to strengthen more their action at country level. And we know that, when it comes to evidence, we have a lot of evidence on stroke. Now, how can this resolution help to translate the scientific evidence into stronger national actions, particularly, in low and middle income countries?
Yeah. I think over the last how many years, 35 years, um, yeah, I think 30 years, I would say, when the first breakthrough for intervention for stroke, that was thrombolysis, it was approved in 1995.
Mhm.
And since then, this health systems have been struggling to implement the intravenous thrombolysis therapy. And in 2014, we had the major breakthrough that is thrombectomy. And even now, countries are struggling to implement these powerful acute intervention strategies. And uh, but there are other very impactful treatments with low cost. That is
Mm.
stroke unit care, implementing stroke unit care with nurse driven intervention protocols. They are almost equal to the intravenous thrombolysis. And so that is the impact that stroke unit care has. So I think to begin with, when we try to approach countries and based on the resolution, what to implement first, the first thing would be stroke unit care, capacity building, training the nurses, doctors, and start this acute care. And that would really have a major impact, irrespective of type of stroke, whether you give thrombolysis or not, and rehabilitation will be embedded into the stroke unit care, and prevention, the secondary prevention will be embedded. So that has a major impact, even in LMICs. Even if there are no neurologists, we could train the physicians and they can initiate the program. So I would say, in terms of rolling out an adoption of this resolution globally, in particular in LMIC, start with stroke unit establishment and work around that. Thrombolysis, you can build rehabilitation, you can build prevention programs, we can build. Ultimately, we need to have acute stroke care and prevention together. Then only we will have a larger impact here.
Okay, thank you very much. So having, like a basic stroke unit at country level, working together with the prevention aspect of stroke, but also rehabilitation and long-term follow-up. Yeah, that's a very good plan. And maybe if I may ask, like if we were having this conversation maybe in 5 years from now, what concrete changes will convince you that this resolution has truly shifted the global response to stroke rather than remaining a political commitment on a paper?
Yeah. So I think for me, there are a couple of key performance indicators. One is stroke units,
Mhm.
establishment of stroke units in countries. So
Mm.
as we discussed with your group in WHO, we need to have at this stage a base survey where what are the availability of stroke units and thrombolysis facility rehab across the globe, and we need to gather that information and uh, then you work towards this implementation. So number one indicator would be the increase in number of stroke units in the countries. That is one strong indicator that will improve the outcome of stroke patients. Number two, stroke quality implementation. And WHO has this stroke center certification program, which we are rolling out globally. And we would like to see in 5 years from now We have a base number now. And 5 years from now, how many more stroke centers WHO has certified? Now, currently, there are about 210 hospitals in the system and about 160 or something we have certified. I would like to see in 5 years from now close to 1,000. So that would be a very strong indicator that change has happened. And the third and fourth, I would say, or maybe the fifth one is the thrombolysis rate, increase in
Mm,
thrombolysis rate for the
yeah.
country,
Mm,
thrombectomy rates for the country,
mm,
and access to rehabilitation. The
okay.
proportion of stroke patients
Yeah.
having access to rehabilitation. So these are the powerful
Mm-hmm.
indicators. I
Mm-hmm.
would say, 5 years from now, if we
Yeah.
are able to document, that will give a good indication that the resolution has been very impactful. Yeah.
Great, great. Those are very clear targets, increasing by tenfold, the number of certified stroke units
Yeah.
in 5 years, and that will be linked to other areas like prevention, rehabilitation, and follow-up. That's amazing. So maybe my last question is: now that the resolution has been adopted, so how does the World Stroke Organization see its role evolving, in sustaining the momentum, supporting countries and partners, and keeping stroke high on the global health agenda?
Yeah. So, as you're aware, that WHO organizes regional stroke summits. Uh, Last year, we had it in Southeast Asia, in Hanoi, where we bring in the policymakers and also healthcare professionals and come up with a strategy for the region. And the next one is in August in Johannesburg for Africa. So we want to do these meetings more frequently. Earlier, it was once a year, and we want to downsize from having workshops, capacity building, and policy to just policy. In that way, we can cut down the cost and have multiple meetings with, let's say, one region we go invite policymakers for 5 countries, work
Mm-hmm.
with WHO, and then sensitize, have the ministry on board. And in that way, we'll be able to continue that momentum. What we have gained from the World Health Assembly. So this is one important strategy we would like to do for the policymakers and also for the country in the ministry. And the second is, I would say, implementation. We want to have a couple of successful demonstration projects where countries where there are no stroke units
Mm-hmm.
or region of a country where there are no stroke units,
Yeah.
as we discussed earlier, conflict-ridden places like Sri Lanka, Iraq, and even Rwanda. If we can get some foundation grants and include what is there in the resolution into these demonstration projects, we could do in a couple of countries in Africa and few in Asia,
Mm-hmm.
where we have the major burden of stroke.
Yeah.
And in 2 years' time or 3 years' time, if you're able to show that these are all models that can be adapted by the countries, and so that would be our second objective, to have a demonstrable project. And we have done some projects in Africa also, but it's not in a very comprehensive way. It's a snapshot.
Mm,
We had some limited industry funding. Start something, but it is not sustainable. The governments are not on board. It is
mm,
just two healthcare professionals in that country who have
yeah.
established a program, but
Okay.
there's no real buy-in by the government. But
Mm-hmm.
through these two important strategies, we will have the buy-in by the government, and so that we make it a sustainable model.
Wow, fantastic. Thank you very much, Prof. Jayaraj. I think this is very clear to keep the momentum, keep organizing this kind of regional meetings where we could still put stroke on the top of the agenda, and also to make sure that the momentum is not only what we have, but we are doing implementation to try to do more pilot cases that could be used as a model to scale, access to stroke care. And this is a very good plan. Thank you so much
Yeah,
for
thank you.
being here this morning. And if you have one last message, for general population, everybody that may be watching us this morning, if what will be that message? Yeah.
Yeah, I think the statement that stroke is treatable and preventable, that should be promoted, and the public awareness, and also to the government. And
Yeah.
it has a huge economic cost, and if we follow these strategies, particularly treatment and prevention, we'll be able to reduce the global burden of stroke.
Right, right. Stroke is preventable and treatable.
Yeah,
Thank you so much, Prof.
yeah.
Jayaraj, and
Thank you.
have a
Thank you very
nice
much.
day. And
Yeah.
yeah, take
Bye bye.
care.
Bye bye.
Bye.